Hi guys, I just wanted to jump on and say that tonight we're appreciating all of the NHS, but for me especially the Queen Alexandra Hospital in Portsmouth, where my friends and colleagues work and do an amazing job. I spent the best couple of years at QA, and I want to say and send my love to my other colleagues at the Royal Bournemouth and Southampton General Hospital. What you all do is amazing. I have the virus and it's given me a pneumonia and a secondary infection. I have an underlying health condition, immune disease and a lung disease, which means I'm more prone to infections. So it's a bit worse for me now. I've been to QA about 3 times in the last couple of weeks, and every time they've given me nothing but expert care. I want to say thank you to the GP who took me seriously and sent me in. I want to say thank you to the ambulance and paramedic staff. I want to say thank you to the tea lady in A&E, to the reg, to the junior doctors, to the respiratory consultant that saw me, to the nursing staff that had to put PPE on every time I called my bell or they came into the room. I've worn PPE. People don't understand the gravity of what it takes to get in and out of it and how tiring it is to wear it all day. And when you don't have enough, and I saw these teams running out of masks, it's wrong. You're making a job that's already hard enough harder. They need more help and support. I want to thank everybody that day, from the radiologist that took my x-ray, the phlebotomist that took my blood, to the porter that carried the blood to the lab, to the biomedical and microbiology teams that tested my blood, to the microbiologist that got me my antibiotics spot on, to the respiratory team, to everybody that takes care of me every single time this happens to me for the last 37 years. I wouldn't be here if it wasn't for you. And I know, I want you all to know, that what you're seeing on the news right now is an average day work for these guys. They do this every day of their life in that job. They save lives every single day. This is intense, and they don't have the equipment and they don't have the support that they need right now, but they're going in and doing their job every day like this. Every day they save lives. Every day there's a shortage of beds. These people are miracle workers and heroes every single day. So tonight, NHS, that's why we say thank you, and we're clapping you tonight. Round of applause for the NHS. Can't clap and hold the phone. Stay well, stay safe, and please, for me and people like me, the vulnerable, please, and for your own sakes, because it isn't just people like me that are getting this, stay at home. Thank you, NHS. Hi guys, welcome back to my video. It's me, Danny. Welcome to anybody that's new here, and hello to all my regular subscribers, and hello to any new subscribers. You're more than welcome on my little journey through life. So if you're new here, you're going to see lots of me as a mature student, so university sort of uni study tube type videos, life as a mature student. In my past life, I was a NHS anaesthetic practitioner, so you will see videos on being an ODP, and so I've just done that for the last 14-15 years, and alongside that, since I was very young, when I was 17, so I'm now 37, nearly 38, I have been a makeup artist. So I've had lots of strings to my bow, so you'll see lots of different videos on here, but you're more than welcome. So today I have to do something quite interesting, and I thought I would share it with you because I wonder if a lot of us might have to do this at some point, and if it might be useful to you guys to see how to do it, because although I'm sort of medically trained, when I first thought about doing it, I thought, ooh, how do you do that then? Okay, so today basically I'm going to be taking a COVID-19 home test. Okay, so I will do a full video on my COVID experience because it's taken up until now for me to be able to talk about it. Not today, I'm going to focus on the test today, but I will get around to filming that, I promise. So long story short, I have an immune disease, which means I basically have no immune system. That has led to me getting frequent pneumonias and chest infections over the years and kidney infections, so it's compromised my kidney. I've got a heart problem anyway, and the years and years of pneumonias and things like that have given me a disease called bronchiectasis, which is a lung disease. So yeah, getting COVID was always a risk, high risk. I'm at university, which made it probably higher. And for my birthday in February, I went to London to celebrate with my brother. And I'm not sure if I contracted it there or we went to a birthday party a couple of weeks later. We just don't know. Family also went to London as well and have been travelling about. So when it was first here, who knows, it was just so easy to contract, especially if you're immunocompromised like me. So I did catch COVID pneumonia. At the time, they weren't testing. It was so hard to get one of these. These were not possible. I got it the end of February, so early March. They were still running a very early testing system. In fact, people were coming out to your house to test you. And I was one of the people booked in to get a test at home. And then the week before lockdown, Boris Johnson cancelled all of the tests. And basically the only way you could get a test was if you're admitted into hospital. I was taken to hospital 3 times in an ambulance because it got worse and worse. And the GP was really concerned that I did have it. So since then, I have had several swabs for COVID to check that the virus wasn't active anymore, or that I currently didn't have a reinfection, because they're not sure if you can get it twice. And so I've had probably a test in May, maybe April, May, and one in June. They've all come back negative, so I don't have the virus at the minute. I'm going to be closely monitored because of my condition. So I was one of the people that ended up shielding. So I was on the level 1, so the most vulnerable. So that would be up there with people who are having chemotherapy and people who are severely immunocompromised. So I was in the house with Mike for 25 weeks in total shielding. It wasn't fun, but it was necessary, and again, probably helped to save my life. So very grateful for that. The monitoring that my GP is doing, I'm probably going to get tested quite frequently, especially since ending shielding and going back out into the world and looking to go back to university next month, although I believe the time I'm going to be spending on campus will be very little. Looking at what they've said to us today, it's going to be a blended pathway of learning, but a lot of it's going to be lectures online, which I'm really disappointed about because I'm kind of like, probably like the rest of you, ready for life to get back to normal. However, I think last week I logged some symptoms that flagged something up. I logged that I had a temperature, very low grade temperature of like 38, maybe 30, 37, 9, 38. And some breathlessness. Now, this is where it gets complicated. I logged that. However, do I think that I've got COVID? No, I don't. A, because I think I've already had it. I don't, and I'm not 100% sure on the risk of getting it again or as severe. 2, I really haven't been anywhere or around people without a mask and a visor and I really just haven't been around people. Although shielding has ended for me, I'm still very cautious. I haven't really been going out unless it's necessary. So I don't think, hi Tinky, that's our kitty cat coming in. I don't think that I've got COVID right now. I feel fairly well in myself. When I logged, I did have a temperature. I was feeling breathless. However, I have a lung disease. So frequently, just talking to you now, I get breathless, and that day I'd probably done a bit of exercise, and I'd probably taken ibuprofen, which I know you're not supposed to do when you have lung problems. However, I have really bad endometriosis, and on that day the pain was really bad and I was having a big flare-up, and it was the only thing that was going to help me. So I was probably really wheezy and really breathless, and when you have endometriosis, those that have it will know that you do get temperature spikes as well. However, with my condition, it's better to be safe than sorry, so I imagine that's what flagged it up. Or maybe they're conducting a study in my area, who knows. But so I have the test. It arrived. Please get online to the website, the .gov website, and I think maybe it took about 4 minutes, and it was done, and one was on its way to me, and it arrived the next day or the day after. So, and obviously if you're thinking that you've got COVID, then you should be isolating for 7 to 10 days. I can't remember which way around it is. I would hazard a guess at 10 days until you know for sure that you don't have it. As should people in your household. So this arrived. This one's going to Scotland. Interesting. First things first, track 24 postage paid envelope. And you just fold up the box to make that, and it's ready to go. You have to do it at specific times, which I'll talk to you about. Next in the box comes the COVID-19 home test step-by-step guide. This is from the government, HM government, test and trace, and NHS test and trace. This manual gives you instructions to test for COVID-19. This is the antigen test to test if you currently have coronavirus. Please read the instructions before you open the test kit. Wash your hands for 20 seconds before you handle the test kit. I've just washed my hands before I came on. If more than one person in your home is taking the coronavirus COVID-19 test, please make sure you have a test kit for each person. You'll need to register each person's test kit. And then you receive your test results probably by phone. So this is my booklet. Taking the sample. Right, for step 1. Find your nearest priority post box. Before taking your sample or registering your test kit, you need to find your nearest Royal Mail priority post box and check its collection times. You will need to post your completed test kit no later than 1 hour before the last collection of the day. Saturday collection times may differ. Do not take your test on a Sunday or a bank holiday. Take it on the following day instead. Let's have a look. Okay, so I have found my nearest priority post box. That is just up the road, so that's really good. Okay, so we've done that. B, click priority post boxes, yeah. 2, register your test kit online. When to register your test kit online. Only register your kit just before you take your test. If you're testing more than one person in your household, you must register each person's details online. Anyone who does not register will not receive their results, so it's very important. Your order ID, see your home test kit email confirmation. Your test kit barcode on the cover page of this booklet. It's made up of letters and numbers. Okay, so there's my barcode there, and I need to look up my email. Your 10-digit order ID is, okay, so Okay, so it has to go in a specially designated priority box. You can only, you need to go online to find out where your priority post box is. You should wash your hands before you start. Only take the test during weekdays, not on the weekend or on a bank holiday. And I think you can do it on Saturday, not Sunday or a bank holiday. And you need to enter from your email where you've registered your 10-digit order ID and the barcode that's on the front of your booklet. Okay. And basically only do the test just before you're ready to take it out to the post box. Right, so let's register online. So I'm just going to copy that code, my ID, and go to register. Let's have a look. gov.uk/register-home-test questions that have popped up. Do you know how you'll return your test kit? You'll either need to find your nearest Royal Mail priority post box or book a courier. Yes, I do know. I'm going to post it. Order ID. Paste that in. Pop your name in. Full name. Date of birth. Royal Mail barcode, so that was on the front of the booklet. Scan my barcode. Okay, that's done that, and it's just literally scanned it and popped up in the box. Continue. There was a problem, of course there was. Scan your barcode. Scan my barcode again. Say my barcode is wrong. Okay. Alright, so that was a little bit tricky. Only because I'm me. Alright, I figured it out. So the first barcode that it was asking for was this one here on the box. The second bit after that it moves to, it was asking for a different barcode, which was on the leaflet. Got it round the wrong way. Okay. When will you take the swab test? Select the date and time you'll take your swab test. If you've already taken the swab test, tell us the date and time you took it. We need to know this so the lab can work out when the test is due to expire. If you select the wrong date and time, it could mean you received the incorrect result. If you're posting your completed test kit at a Royal Mail priority post box, do this 1 hour before last collection. That's not till 5 o'clock. So, but we've got a collection coming up in about an hour, so that's fine. If you're returning it by courier, take your test at least 1 hour before 8 AM on the morning of your collection. That's what I did last time. Alright then, so I'm selecting today's date. It's not the 29th, it's the 28th. Enter a time, hour, save and continue. Security check, I'm not a robot. Palm trees, palm tree, palm trees, palm trees. Verify, security check ticked. Save and continue. Home test, registration confirmed. Next steps, take the swab sample, follow the paper instructions in your home test kit. If you have registered multiple kits, blah, blah, blah. Register another test kit. No, I'm good. Instructions number 3.
take swab sample from your tonsils at the back of your throat and then your nose. This is not very nice. I don't like doing it to patients. I don't like doing it on myself, so I'm not going to lie to you. It's not pleasant, however, it's very quick. You will gag. Okay, judging from what happened last time, you need to go right back. If you're like me, you don't have tonsils. It might be easier for most people to use a handheld mirror or go and stand at a big mirror with a good light and do it there. I don't have tonsils, and I've done this many times on patients and myself, so I kind of know where I need to go. But basically, if you can see your tonsils, even better. So if you can touch your tonsils and around that area, that's where you need to be going on both sides, and then both sides of the nose. So it needs to go, don't shove it up, it needs to go to about here, and you want to just kind of rub very gently on the inside, but be very, very careful putting it gently up your nose. It doesn't need to go any further, but it will tickle. This one isn't very pleasant, but if you can see your tonsils, then great, aim for there. If not, you kind of know if you've had your tonsils out whereabouts they were, so just aim for the very, very back of the throat, the very, very back, and you need to touch the area of the throat, actually physically touch it with the swab, and do a good couple of circles, really, as much as you can tolerate. It's not very pleasant, and I will turn the sound off while I do it, but I do want to show you how I'm doing it, so I do apologise. I will turn the sound off because gagging noises are not very pleasant. Taking the test will feel a little uncomfortable and unusual for most people. Remain calm and confident as you go through the process. If possible, do a mock practice without using any of the practice materials. It might be helpful to watch an online video. That's why I'm filming this for you. Okay, I'm going to go and wash my hands. So you should wash your hands thoroughly for 20 seconds using soap and warm water. This is so that you do not contaminate the test kit. Clean and dry a surface to place the home test kit on. Unpack everything from the kit onto the clean surface. Use the test kit checklist to make sure you have everything. Right. Mike's not here, so I can't film me doing it, but for my ODP students, I was going to do a surgical scrub, how to surgical scrub, and do a social hand wash video for my ODP students that are learning to work in the operating theatre. So I was going to do that anyway, which I will do shortly. However, I'll just give you a little rundown. So alcohol gel is not enough for this. You do need to wash your hands. I'm going to go and do that now. Okay, I'm back with clean hands. Right, so let's go. Book. Right, so to take the test, we should have the following. A Ziploc bag. Yep. Swab inside a sealed wrapper. Check. Make sure that you check that this is sealed. Plastic vial containing a small amount of liquid. Check. White absorbent pad. Check. Biohazard bag. Okay, that's the Ziploc bag. Wrong way round. And that is the biohazard bag. Yep. Security seal. Yep. And the box to return it. Yep. They've made it very simple. Okay. Look inside the mouth and find your tonsils at the back of the throat. Or the area. So it is when you find your uvula. Your uvula is the dangly bit at the back of your throat. Tonsils will be either side of that, and they will look like... Hard way to describe it, really. What does a tonsil look like? It's just a very squashy, flat bit of tissue that's kind of inflamed quite often at the back of the throat. It's usually the same colour as the back of the throat, unless you've got tonsillitis, in which case it might be yellowy with white spots on it. Hopefully not. But yeah, so you will see these little protrusions from the normal angle of the throat at the back on both sides, with the uvula, the dangly bit, in the middle. If you're performing this on yourself, use a mirror. If you're doing it for somebody else, use a torch. Tonsils, or where they would have been if they're removed, are where you will swab. Gently blow your nose and cough into a tissue. This is so the excess mucus does not interfere with the test. Throw the tissue away in a closed bin. I've just done that in the kitchen. Wash your hands thoroughly, which we've just done. Open the package and take out the swab. This will be used for both tonsils and nose, so only one swab for both areas. Okay. Do not touch your tongue, teeth, cheeks, gum or any other surface with the fabric tip of the swab. If it touches anything else, it may invalidate your sample, so it needs to go where it needs to go, the back of the throat and the inside of the nose. Taking the sample may cause gagging and minor discomfort, but it should not hurt. Holding the swab in your hand, open the mouth wide and gently rub the swab over both tonsils at the back of the throat for 10 seconds, so 10 seconds each, I presume. Use a torch and or mirror to help you do this. Remove the swab from the back of the throat. Put the same end of the same swab, we only have one, gently into the nostril about 2.5 centimetres. So on the picture it shows that for the nose, that for the throat. So it's showing about here is how far you go up. Rotate the swab for 10 to 15 seconds and slowly remove it. You only need one sample, one nostril. You only need to sample one nostril. Oh man, I didn't know that last time. If you have a piercing, use the other nostril. This may feel uncomfortable. Do not insert the swab any deeper if you feel strong resistance or pain. Okay. Next, put the swab into the vial. Make sure the fabric tip is facing down into the liquid. As you place it into the vial, snap off the stick end so that fits inside the vial without bending. Securely screw the lid onto the vial. Important, you must keep the liquid in the vial. Okay, so it should snap off like that. And then wash your hands again. Right, so shall we do this? So we've washed our hands. I've got my swab. So I'm opening it with the Q-tip end, the cotton bit at the bottom. Sometimes they're not easy to open, like as in to peel. So if you snap it like that, okay, so I've opened it, taking it out. I'm going to turn the sound off now. Here goes. So 10 seconds on each side of my tonsils of my throat and up one nostril for 10 seconds. Here we go. I apologise. That was not pleasant, but needs must. Okay, so I'm now taking my vial. Taking the lid off carefully, and I'm going to, so you can see that the liquid's still in there. Very carefully without touching this end again. Pop that into the fluid. Okay. Okay, so I've popped it into my vial, into the liquid, and there is a little break just here. There's a little break just there, and I've just snapped it off. Okay, so I'm now going to put the lid on. It's already got a label on it which corresponds with your other label, so you don't need to add anything on or write anything. No writing, no need to label it again. It's already there for you, personally for you. And there it is in there. Put that on nice and tight. So next thing, we are going to first place the absorbent pad in the Ziploc bag. So this is the plain Ziploc bag. Absorbent pad goes in. Place the vial next to the absorbent pad in the same bag and seal the bag. In it goes. Make sure it's nice and sealed. Okay, place the Ziploc bag into the biohazard bag. Make sure the barcodes on the plastic vial and the biohazard match. Okay, barcode on the vial, barcode on the bag. Yes, they do match. So it now goes in here. Expel air from the bag. And then peel off tape to expose the adhesive. I'm not very good with these things. So we've got a silver adhesive. So peel that off. There we go. That's stuck to me now. And then seal it like that. There is bits to write on it, but you don't need to write anything, okay, because there's already a barcode on there, so you're good to go. And then we just need to pop it into the box. Make the box up. It's just one of those little foldy boxes. Pop it in there, and I'm going to take it down to the post office now. There we go. COVID-19 test done. Not very pleasant, but necessary, and actually not that terrible really, and very easy to do. They've made it very easy and very foolproof. I hope that you found the video easy to follow. I hope that you don't think it's like teaching you to suck eggs, because definitely not my intention. It's just that I know that even being a medical practitioner that's done it on patients, when it first came to my home, I thought, oh gosh, I don't want to get it wrong. What if I sort of mess it up and tests are different? So I was looking online for a bit of help, and I think a video to follow would have been good. So I hope that you guys like it. So I will do a video on washing hands, because I think it's really important at this moment in time. Hygiene, personal hygiene and hand washing is probably, one of the best things that you can do, including wiping down surfaces that you may not have thought of before. So quite often I get the Dettol, again not sponsored, or any sort of anti-bac wipes, and I'm just more conscious now of the home, what we do and don't touch. So the TV remotes, our phones, the door handles into the kitchen and the living room, the doorbell on the front of the door handle on the front and back of the door, table services. I change the hand towels in the bathroom more frequently as the tea towels. I wash our towels, probably new fresh towels, a good couple of times a week. Anybody that has come into my home has had a separate hand towel. If they've used my bathroom, I'm quite specific. I do go up and give it a clean afterwards, which is not a reflection on them. It's just trying to be safe, being so vulnerable myself. Guys, thanks for watching. Yeah, so I will talk about my COVID experience. It wasn't fun. My husband's here. I'm going to drop this off at the post box now. Hope this has helped, guys. Sorry for the ramble, but I mean, it's just been a crazy time, hasn't it? And I want to get out there and get on with life. I cannot be scared of this virus anymore, because I have been. I have to go back to university in September, and if not, if it is online, I have to go to the library and study. I have to see the girls, because I cannot be scared of this anymore. I'm here. I'm back. I'm trying to film videos for you guys. It's been really, really difficult. I know the videos haven't been going up, and I apologise for that. I really am just doing my best. I've been holding on for dear life this year, and I'm just really trying to do my best while still trying to do YouTube, while still trying to do my beauty. All of my makeup clients have cancelled till next year. Their weddings have been cancelled. I'm still, trying to run my house and my home, and, me and Mike, our relationship, Mike's job, university, school, online exams, results, going into year 2 from year 1, trying to read the books, not having a reading list. It's just so much. Trying to see family and friends, looking after family and friends. My mum's not very well at the minute. All of it is just too much some days, but doing things like this really, really helped me. So I hope you've liked this video, guys, and thanks for being patient and sticking around. Hello to my new subscribers. Hello to you guys that have been with me from the beginning. I love you all so much. So much love to my friends and family as well. We're going to be okay, and hopefully this time next year I'll be talking to you about something very different, something happy, and not about COVID testing. Hopefully we'll be in a different place. Until then, please stay safe, take care, wear a mask, wash your hands, social distance, look after yourselves, guys. I love you so much. Follow me on Instagram at Daniela_Logan_makeup for makeup and my life, or for university at medieval_universitygal for school and university stuff and medieval history. Alright guys, love you so much. Take care, and I will see you soon. Take care. Bye bye. Hi guys, just a quick one, just wanted to update you. So I did my test on Friday, and on Sunday night, so last night, I got my text message with my results through to my phone, and it said NHS COVID-19 notification, dear Daniela, date of birth, your coronavirus test result is negative. You did not have the virus when the test was done. So there we go. At the minute, I do not have coronavirus, which we already knew, but there you go. And that's as easy as it is. So I hope you guys found following the video easy enough to do. I enjoyed filming it for you, and I'll see you soon. Take care. Look after yourselves, guys. Bye-bye.